when we talk about balancing our hormones, people would notice a lot of things. Can weight loss be one of those? And especially, is that where we get the belly fat problems as we get older, and that's the kind of fat that's so hard for people to lose?
Well, and it's also so dangerous, right? We know that belly fat and upper body fat increases our risk, is associated with a higher risk of metabolic syndrome and cardiovascular disease, heart attacks, strokes, dementia, the list goes on from there. So weight gain in this midlife is a function of our rewiring, our metabolic stall that our body is going through. So getting into this kind of keto green lifestyle can push us through that. So we're really using powerful energy, ketones for fuel, over glucose, and that makes a difference. So we're not depositing and storing as much fat, and that makes a difference. So women who have lost their waistline, which we all complain about when that happens, we can get it back, right? So that's really important. We can see that shift and see that weight loss as you've established a really healthy balance with nature. Utilizing this type of program and lifestyle can really make a difference. So weight loss is a beneficial side effect of getting your hormones back in balance, but more importantly, the heart benefits, the brain benefits, and the relationship benefits. Because I tell my clients, if you only hate your husband 2 weeks out of the month, it's probably your hormones and not your husband's. So by understanding that yes, physiology drives our behavior, right? It does drive our behavior. So if I'm thinking these things, I'm not well, right? Resentment is lack of self-care. So self-care has to be a priority if we're struggling with hormone imbalance. It's necessary for us to have a good quality life, and even more importantly, relationships.
A lot of the things that we've been talking about are focused on women, but so many of these can apply to men as well, right? I mean, this is not just a woman's book or issue.
No, definitely I completely targeted women going through transition, this hormonal transition, because this is where women get ridden off. But the husbands and the boyfriends of people that have gone through my program do so incredibly well. It's really frustrating. I always tell women, men will do the program and they will lose twice as much weight, twice as fast. They get it and they're on it and they do it and boom, right? And they get so much good results. I always joke with my patients, because I have a magic menopause program online too. I'm like, you're a strong guy to do magic menopause, right? It takes a good self-image to do magic menopause. And so many guys I wouldn't do anything else, right? That's it. That's the way to do it. And it does. It absolutely 100% by design works really incredibly well there's no one who can't do it the way I've outlined the program and constructed it. Unless they're severe on insulin pumps or, need definitely get the guidance of your physician if you're taking any medications, the standard precautions. But really we've seen some great results. People come off diabetic medications, blood pressure medications, and just feel better. One lady told me, Kathleen, and she goes, Dr. Anna, not only do I like myself better, but I like my family too. And she goes, and you know what, Dr. Anna? They like me better too. We're spending time together. That totally changed her life. She used to come home from work, lay on the couch, and not want to get up. Give everything at where she was working all day, come home and just be exhausted. She goes, now we do things. We go out as a family. I hadn't been in my backyard for years. And she said, I'm pruning and I'm fixing it up and I have the energy to do this. And my kids and my family, they're coming to visit more, That's what I love. That's the blessings, that understanding. It's not just about what we eat, and putting it all together in an easy way that we can live a really joyous, comfortable life with. That's the benefit.